My name is Dr. Christy Webb, and I'm a psychologist in Chapel Hill, North Carolina. I've made over 10 videos on various aspects of therapy, especially in my area of expertise, which is borderline personality disorder and dialectical behavior therapy, or DBT. This video is about whether borderline personality disorder, or BPD, can be diagnosed in adolescents. The video is going to be divided into 3 parts. Part 1 is, why shouldn't BPD be diagnosed in adolescents? What's the problem with doing so? The second part is, what are the arguments in favor of diagnosing BPD before age 18? And the third part of the video is, what kind of treatment is available to adolescents who show symptoms of BPD? I have other videos about borderline personality disorder, and you may want to watch the one called Understanding Borderline Personality Disorder for details about its diagnostic criteria. To give a brief review, though, our personalities are patterns of perceiving, relating to, and thinking about our environment. Those patterns are stable over time and across different situations. So at home, at school, at work, while we're shopping. When our personality traits are rigid and maladaptive, meaning that they don't always fit the situation that we're in, when they're out of step with what our culture expects, and when they cause significant impairment to us or make us really unhappy, then we're talking about a personality disorder, of which there are 10. The pattern has to be stable and of long duration, and it has to be present at least by adolescence or early adulthood. BPD is one of the personality disorders, and the maladaptive patterns of perceiving, relating to, and thinking about the environment of a person with BPD can include frantic attempts to avoid real or imagined abandonment, unstable moods, chaotic interpersonal relationships characterized by seeing the other person as wonderful and then suddenly seeing them as horrible, impulsivity, difficulty controlling anger, and suicidal thoughts or gestures, or non-suicidal self-injurious behavior. So why shouldn't BPD be diagnosed in adolescence, that is, before turning 18 and being considered an adult? We're going to start with a very practical reason and then move out to a more philosophical reason. The practical reason is found in the book we used to use containing all of the mental health diagnoses, called the DSM-5. It stipulated that personality disorders are diagnosed starting at age 18, and insurance companies therefore wouldn't recognize the diagnosis until the person was 18. If you think that's the tail wagging the dog, I agree. But if you're someone who wants your child to get treatment for their behaviors and that child is under 18 and you want to use your insurance to pay for treatment, then BPD is probably not the diagnosis that will be assigned. Even though we no longer use the DSM, the culture is slow to change, and very few clinicians are going to read the DSM's replacement, the ICD-10, especially if they're not specialists in borderline personality disorder. Another practical reason for not giving the diagnosis before adulthood is that this diagnosis comes with a stigma. Not only some therapists, but anyone who's seen the movie Fatal Attraction, some who have had partners, roommates, or co-workers with BPD, even some popular books about BPD, all stigmatize it. I can certainly understand wanting your child to be given the diagnosis of depression or substance use disorder, rather than borderline personality disorder. Since October of 2015, we no longer use the DSM, but its replacement, the ICD-10, says that symptoms must have been present for at least 2 years to get the diagnosis of a personality disorder. It's impossible to be sure that an adolescent's behavior is not transient, that it won't pass. Their brain hasn't yet finished developing, and they're still figuring out who they are. They aren't yet old enough for their behavior or their personality traits to be stable over time. Not enough time has passed in their lives. If you've spent any time at all around teenagers, you know that they grow out of many of their behaviors, and that what looks like mental illness in a 16-year-old such as fury when someone close to them is late, or being easily bored and restless, keyed up, agitated, or even non-suicidal self-injury, those things can be gone by age 18. Adolescents and young adults with identity problems, those who have trouble answering the question, who am I? They may behave in ways that suggest BPD, especially if they're also using drugs and/or alcohol. So they might be emotionally unstable, anxious, feel uncertain when they're faced with choices, and they may be very sensitive to peer pressure. They might lose those traits, leave them behind as they mature. But they might not, so now let's move on to part 2 of this video. What are the arguments in favor of diagnosing BPD before age 18? Once again, we're going to begin with the most practical reason. It could save lives. If the diagnosis could be assigned at, say, age 15, and insurance companies accepted it, then families could get help for their teens, and the rate of teen suicide due to the despair that a highly sensitive young person feels would drop. And more philosophically, isn't it arbitrary to say that the day before your 18th birthday, your behavior doesn't meet criteria for BPD, but the next day it does? Where should the line be drawn? A month before the birthday? 3 months before the birthday? Why do we deny treatment on such arbitrary grounds? What the diagnostic manuals say is that a personality disorder diagnosis may be applied to a child or adolescent in the, quote, relatively unusual instance in which their personality traits seem to be maladaptive, pervasive in every area of their life, persistent, and unlikely to be something they'll grow out of. The manuals caution that the traits of a personality disorder that show up in childhood generally don't persist into adult life, and that for someone under age 18 to be diagnosed with most personality disorders, they have to have shown the symptoms for at least 2 years. That is to say, the behaviors have to have persistently interfered with daily functioning, and that this must have been going on for 2 years or more. Aren't parents the ones best qualified to know this, not a diagnostic manual? Research shows that the symptoms of BPD can remit, they can disappear with treatment. This is another argument for early diagnosis and treatment, to get in there before those behaviors get locked in and become so ingrained that they're harder to dislodge. So finally, let's turn to part 3 of this video. What treatment is available to an adolescent with borderline personality disorder? In fact, that's the good news. There's robust treatment, meaning that it is supported by the research as being effective. Jill Rathus and Alec Miller, who are both DBT therapists and researchers, have adapted the DBT protocol for teens, and they've published a book, DBT Skills Manual for Adolescents. Here in the Triangle area of North Carolina, we have 8 to 10 DBT groups a week for adolescents and a caregiver, and they work. So if you are a teen, or if you have a teenage child, and you suspect that borderline personality disorder is the appropriate diagnosis, I urge you to argue for being treated as if that's what you have, especially if there is suicidality or non-suicidal self-injurious behavior going on. In my own practice, and I only work with adults, but I tell my patients that I don't actually care what we call their disorder. I'm perfectly happy to give a less stigmatizing label if they want, because I'm going to treat their disorder in the way that I think is best. So look for a therapist who is knowledgeable about borderline personality disorder, preferably one who's trained in dialectical behavior therapy. DBT is a proven, effective treatment for BPD. In fact, it's the gold standard. And that's true for adolescents as well as for adults. I've put a link to a website at the bottom of the screen to get you started. And best of luck.